Okay, good evening, everybody, and welcome to the Board of Health meeting on Monday, March 18th, 2024. Let's see, we have some action items. We're going to jump right into our invoices. We have 3 invoices. One from Amazon for $31.78 for a blood pressure cuff. Crystal Rock for $5.29, that's for water. And Happy Frog for $169 for blue ink envelopes. So I will entertain a motion to accept and pay those invoices as presented.
I'll make a motion to pay them.
Okay, that's a motion, Andrew. Do I have a second?
I will second.
Second, Thomas. Any further discussions? Hearing none. All in favor say aye.
Aye.
Aye. That passes. Okay, we have our minutes from the March 4th meeting. I think all members were present and accounted for.
No, you weren't.
Oh, Thomas was not. Okay, so you're going to abstain from voting, I'm assuming?
Correct.
Okay, so I will make a motion that we accept.
I'll second that motion.
Okay. Any further discussion? Hearing none. All in favor say aye.
Aye.
Aye, so that passes with one abstention. So, let's see. Okay, so we have one local upgrade, 35 Fieldcrest Drive. Jean Marie?
This is a repair. They're asking for a couple of different variances. Variance from doing a perk test using sieve analysis, and a variance to allow for 3-foot separation to high groundwater from the 5 feet required. It's allowed under the geomat leaching system.
Okay.
So that would allow them not to
Okay.
have a huge mound in the back of the yard.
So I'll make the motion that we accept the variance as presented. Do we have a second?
I'll second that.
Okay, second, Andrew. Any further discussion? Hearing none. All in favor say aye.
Aye.
Aye, so that passes. And then we have new construction, 15 Chestnut Street in East Bridgewater.
Yep, this is a house that burned and they tore it down.
Oh, that's right.
It meets code for new construction.
So they're completely replacing the septic system that was there?
Yeah, it was a cesspool.
Oh, really? Okay, I knew the house was old. I didn't know it was that old.
Rooms were tiny too, like 7 by 10, like.
All right, so I'll make the motion that we accept the new construction for 15 Chestnut Street in East Bridgewater. Do I have a second?
I'll second. Nope. Go for it, Tom.
All right, second, Thomas. Any further discussions? Hearing none. All in favor say aye.
Aye.
Aye, so that passes. Okay, food service establishments. So we have one, Mama Crochetti's.
New mobile food.
I'm sorry?
So there's 3 different ones here.
Where's the other?
Enjoy Fancy Donuts is gonna be a coffee and donut food truck.
Above the highlighted.
Oh, okay, all right, there we go. All right, so we have one mobile food truck, Enjoy Fancy Donuts, a renewal for a food truck, Bert's Ice Cream,
Yep.
and a new food establishment, Mama Crochetti's, on 392 Pleasant Street.
That's where Amante was, and then Harry's something
Yep.
pizzeria.
So they're gonna have prepared to go.
They do prepared to go on something the size of my desktop here.
Yeah, that's over at
So
there.
they're expanding that
Yep, very good.
that section.
Okay, excellent.
with a nice clean kitchen that's not older building.
All right, so I'll entertain a motion that we accept the food service establishment permits as presented.
I'll make a motion to accept
Okay,
that.
motion Andrew, do I have a second?
I will second.
Second Thomas. Any further discussions? Hearing none. All in favor say aye.
Aye.
So that passes. We have one rubbish hauler permit, a renewal.
Their application's complete.
Okay, thank you. So I'll make the motion that we accept the renewal for L. Harvey and Sons hauler permit. Says motion Lyons. Do we have a second?
I will second.
Second, Thomas. Any further discussions? Hearing none. All in favor, say aye.
Aye.
Aye, so that passes. And installer's license, renewal, W.R. Logan Excavating Contracts Incorporated.
His application's complete.
Okay. I'll entertain a motion that we accept the installer license as presented.
I'll make a motion to accept it.
Okay, this motion, Andrew. Do we have a second?
I will second.
Okay, a second, Thomas. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that passes. Excuse me. Okay, we have one betterment loan application.
The application is complete.
It's all complete, okay. I will make the motion that we accept the betterment loan application as presented. Do we have a second?
I'll second it.
Okay, that's motion Lyons, second Andrew. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, and that passes. Okay, so that concludes our action items for the most part.
Quite, but
We still have one more action item.
Let's
The annual
see.
Town
Board of Health.
report.
Oh, that's right. Okay, so we do have two more after that. All right. But we do have a presentation. We've been fortunate, very fortunate, this semester to have an intern from Stonehill College. And our intern, Lauren Diarco, is a student studying health sciences over at Stonehill College. So Lauren is going to give us a presentation about the chemicals PFAS and some of the challenges that they put forward and some of the issues that we have in a certain section of town. So, Lauren, if you don't mind, if you could come on up here and join us at the table. And what you want to do is just introduce yourself, and I know you're not from East Bridgewater, but if you just let us know your address and then take it away.
Thank you. Good evening. My name is Lauren Diarco, and I'm currently living at 350 Washington Street in Easton, Massachusetts.
Okay, welcome.
Thank you. So today I will be talking about the industrial drive in East Bridgewater and the PFAS contaminated wells on that property.
Mm-hmm. Okay.
So what are PFAS? They're also known as forever chemicals. They are man-made substances that linger in the environment. They are most commonly found in firefighting foams and fire-resistant clothing. They are also found in a variety of household items, hygiene products, and food packaging. So where are they found in the environment? All 50 states in the United States have PFAS contaminating their environment. It is commonly found in air, groundwater, and surface soil. If humans are to inhale or consume these chemicals, this poses health risks. So what are the health risks? Long-term exposure to PFAS chemicals increases risk of kidney and other cancers, increased cholesterol levels, reduced immune response, and infertility. Those who are at high risk include immunocompromised individuals, pregnant women, and infants and children. Children could experience growth and developmental delays if exposed. So the PFAS at Industrial Drive in East Bridgewater. The Industrial Drive has 5 contaminated wells that have PFAS levels 123 above the safe limit, or in better terms, the acceptable limit. The well water in this area is not safe for humans to be exposed to. And I've also included a map of the property, and the red dots are showing where the wells are located, and then in highlighted is the proposed subdivision. So what the health department could do, the health department could hook up to water supply for drinking water. They could prohibit irrigation wells due to concerns of migration and exposure. And another option is they could place hold on installation of irrigation wells until more tests have been completed to assess exposure. And I've just included some additional resources on the chemicals. That's it.
Okay. Okay, so we have 5 wells that are contaminated. If I remember correctly, it was 123% of acceptable levels
Yes.
of PFASs. So one of the recommendations is continued and more frequent testing. And correct me if I'm wrong, what that will do is that'll give us an indication of the chemicals, I guess, migratory process in groundwater?
Yes.
Okay. All right. So excellent job.
Thank you.
Thank you very much. If we could get this deck to the board members, that'd be great.
Okay.
And then, and maybe print a couple of extra copies. We'd want to talk to the planning board as well. So just so that they have a heads up of what we're talking about, and we can be collaborative in that process. So, but again, great job. Thank you very much for that. And does the board have any questions at all? Okay. So this will, and just for the board, this will be obviously future discussions, and we'll take some action based off of further conversations and part of the part of the ongoing conversations that we'll have as to what's the best way forward. So, okay, Lauren, again, thank you very, very much.
Thank
Okay,
you.
Thank you.
I'll take
Investigatory. Holy smokes.
Investigatory.
My teleprompter went haywire. Sound like it should be running?
Exactly. All right, so in our deck team, we have our annual report to the town of East Bridgewater from the Board of Health. So I'm going to make a motion that we accept this as presented and enter that into the record. This is our annual report to the town. So that's a motion, Lyons. Do I have a second?
I'll second it.
Okay, second, Andrew. Okay, any further discussion? Hearing none, all in favor, say aye.
Aye.
Aye, so passes. And we have on here as an action item, but it's, do you want to do this now, Jean Marie, and then we'll take it off the health agent update?
Sure, if you want to do that.
It's up to you, whatever you want to do here. So the Bridge Street landfill project it's still a work in progress, but I'll let Jean Marie address that.
Basically, the RFP was given to Charlie, town administrator, in January, and he sent it out to Sampson and Weston, which is the town's engineering firm, and I haven't gotten anything back yet.
All right, so we
So we're
just
gonna keep-
need to circle back with the
Yeah.
team and just make sure that that somebody over at Sampson is processing this or giving us some advice and counsel, and then we can move forward.
Right.
Okay. All right, so, Jean Marie, do you want to go over the rest of the health agent updates?
Sure. I know it looks a little light, but it's only been 2 weeks since our last meeting, and the one before was 4 weeks, so that's why it looks that different. Site assessments, perks, observations, et cetera. I didn't do any new construction, but I did 98 Brenda Avenue repair. Plans submitted. You did 15 Chestnut Street, thank you. On Thursday, I just got 3 sets of plans, 3 different areas for off Winter Street. It's the 77 to 80 townhouses that are being proposed in the Celebrity property. They were done under 3 different homeowners, and basically, it's been parceled up into 3 septic systems with 6,900 to 9,900 gallons per day. 10,000 is the limit for local Board of Health control. So where they have common ownership, this should probably be going to DEP. So I reached out to town council just to make sure in case there was some litigation with this. He agrees with me, and so doesn't DEP. And I have those 2 emails with me. The plans are upstairs if you want to take a peek at them. Might want to familiarize yourself with this project. But right now, I'm going to have it on the agenda the next meeting because I only got it an hour before we had our cutoff. It was too much to look at in one night. So you're going to have to do an action on that. Okay? Repairs, 35 Fieldcrest you've done. Systems under construction, 1517 Daisy Lane, 112 Cedar Street. Repairs, we have 184 Belmont, 274 West Street starting. Food inspections, we're pretty much fully into the electronics now. I had to go to Dang's at 225 Carriage Crossing. Someone said they were closed. It was only to swap out some equipment. And I applaud them for doing it, not being open while trying to fix things. So they put a new floor in and swapped out some of the old walks. They were on wooden frames, and they were just starting to canter and not be on a level surface. So, and we've been down to 210 Pond Street. They want someone to go in that little deli that's in that convenience store. So I've been working with that on that. No wells, no housing, don't jinx me. Not any complaints, don't jinx me. The beavers, we did a flyover from Meadowbrook, from like Peaceful Meadows all the way down. It was done last Friday. It's very flooded conditions, so we actually couldn't see all the dams. But you could see all the flooded conditions they're creating. So they're
Okay, so
probably,
just for clarification, the flyover was done by the Plymouth County Mosquito Control.
right.
When we say
No.
we, it wasn't necessarily
No, it was
us.
done by Old Colony Planning Council
Old Colony Planning
with a
Council. Okay, that's
drone,
what I want.
a
Okay,
drone
That's right.
over. So this project has a lot of moving parts and it's going forward. They'll do another drone flyover when we can see the dams better. And then I'll have to go through both Conservation in Whitman and East Bridgewater, and Mosquito County Control will be doing the removal of the dams. Any questions on that one?
So just to sum up, the Plymouth County Mosquito Control, because of the amount of water, and mosquitoes breed in
Right,
obviously
right.
standing water, they're gonna take ownership of the project. So,
That part of it, yes.
okay.
We
Oh,
still will have our diversionary dams that we've put in and those kind of things. There's no final way to take care of the problem. It's just kind of ongoing as we go in 5 years, you know? The dams, the beavers, you can't take the beavers out and remove them. So they're gonna always be building dams back up. So it's just to get rid of the
Okay,
big
so
ones.
when it comes to the final removal of the dams, is that gonna be Old Colony Planning Council? Is it going to be Plymouth County Mosquito
Plymouth County
Control?
Mosquito Control,
Okay, so they're the ones who are actually gonna be physically
right.
removing the dams.
And since they are physically doing that work, they are required to submit to conservation.
Okay, so they're working with Whitman's Concom and East Bridgewater's Concom.
Right,
Okay,
okay?
excellent.
Emerging public health concerns, right now, not much. Flu's on the decrease, all the respiratory ones seem to be decreasing out. German measles and chickenpox are starting to slide up. And by that, I mean, we haven't had cases in a while, so even 3 or 4 would be an increase. But we expected that. People on vacation, they're in close contact with each other in airports, what have you. Tobacco and vaping, nothing new there. We'll have to look at those regulations at some point.
Yep.
And the PFASs, Lauren presented. That was a very summary of what we were doing. We have a more in-depth position paper for the board that runs about 8 or 9 pages, just to give you that. And then if you want even more than that, we have a larger set. So that was just a summary. And she did an infographic for the website that's pretty darn nice, too. So we're approaching that on different websites and different methods.
Okay,
Okay,
excellent.
that's it for me.
All right. Okay, Sandra, anything?
I do not.
No? Look at that, the sun's
I
high
know,
above out
right?
there. Look at that.
So nice.
Been a while since we've seen that.
Yeah,
Yes.
really.
Okay, gentlemen, anything else? Okay, nothing from the chair. So I'd entertain a motion to adjourn our meeting for March 18th.
I'll make a motion to adjourn.
Okay, that's a motion. Andrew, do I have a second?
I will second.
second Thomas. Any further discussion? Hearing none. All in favor, say aye.
Aye.
Aye. Okay, so that concludes our Board of Health meeting for Monday, March 18th, and our next scheduled meeting is April 1st, I believe.
It is.
Correct? Okay,
Yep.
great. All right, so we'll see everybody on April 1st. Thank you very much.